Welcome to Glioblastoma Strategies and Tactics with Eric Deisinger.
Hi everyone and welcome back. I know it's been ages since I did my last video, but I will explain in this video why it's taken so long for me to do the next one and also tie into the previous video. So let's roll the clock back to early March where I had an MRI scheduled. And this was my first one in a 4-month time frame because, to recap, the last 2 MRIs, the tumor was gone, maybe 3. Memory. So at least the last 2 MRIs, the tumor was gone. I made some changes to the protocol, and I was now 4 months between MRIs. And so my MRI was in early March. And unfortunately, it had shown a recurrence. So yes, I had a recurrence after getting rid of the tumor. According to the tumor board and my neuro-oncologist, this was dormant cancer cells waking up. And as you might have guessed, this was the reason for the last video about cancer cell dormancy, which occurred after early March. So I guess in the discussion with the tumor board, they still felt, the head of neurosurgeon felt the tumor was still operable because it was still in the same tumor bed. It had gone a little bit deeper, but they still felt it was resectable. So I was set up a meeting with the neurosurgeon, and this was the same one that did my biopsy and resection nearly 3 years earlier. So I met with him to discuss the next steps. And yeah, he gave me the insight. He was watching my history, was impressed that I was able to shrink a tumor down in 12 months, and because he says nobody does that every day. So what he wanted to do, schedule an MRI in late March with spectroscopy to see what was truly coming back in my head. Fair enough, 3 weeks. And he had said, or I should say, he asked if I had gotten back on my protocol since getting the results of this MRI. And I said, yeah. And so he said, okay, I'll make a deal with you. You continue on that protocol until late March, which would be the next MRI with spectroscopy. And if that MRI shows a significant improvement that the tumor was starting to shrink again, we could talk about foregoing surgery and continuing on your protocol and watch it over time. I thought that was a fair option. So we agreed to that, and he also wanted, the next time we met, he wanted to know more about my strategy and my protocol. Because like I said, he was watching my progress for the time since he did surgery on next. I was his longest living patient to date. And what I did was truly amazing to them. So during these 3 weeks between MRIs, this gave me the chance to investigate cancer cell dormancy, hence the previous video. And, to those that have not had a recurrence and have been long-time survivors, I would recommend you look into this because you may have a ticking clock of the cancer cell, or the cancer cells that you have not destroyed may wake up at some time. Just some food for thought. Um, but yeah, I looked into this and, obviously looked in my protocol. And I had made changes to the protocol in October of 2021 last year, and as well as in July 1st of 2022, when I had gone to the maintenance protocol. So, and the only thing that I could see studying the cancer cell dormancy was that dropping niacin affected many of the pathways that were described in studies that were impacted or that impacted cancer cell dormancy. So, I continued this on through late March and went through the MRI with spectroscopy. And a few days later, neurosurgeon called me on the phone, and he told me that the tumor had increased significantly, and he recommended surgery as an option. I could not believe this. But on the conversation, what was interesting, and he just said he had got the results from the medical doctor that reads the MRIs. And he had only discussed the first 2 of 3 normal measurements. Normally you get the anterior posterior measurement, the AP, the transverse, and the CC, the causal cranial measurement. Because I always track the increase or decrease based on volume. But in this late March MRI, he was only giving me the first 2 measurements. And of course I compared it to the early March ones, and I'm like, well, the first one actually went down. But yeah, the second one had gone up significantly. And so he asked, well, what do you want to do? Should we schedule time with surgery? And I said, well, let me discuss it with my family, because they're involved in this decision as well, and I'll get back to you in a day or 2. So I discussed it with them, and, we opted for surgery because, that second number had increased, and that could be a sign of something bad going on. So we agreed. I called them back a day or 2 later, and I said, okay, yeah, we agreed to surgery. He thought that was the best option, and we agreed with that. So, but I just told him, I said, I was really, astounded that the protocol didn't do anything. I mean, it didn't even seem like it slowed it down at all. So, but, we agreed with moving forward. He would get some dates for me of when he could secure dates, I should say, when he could get me into the operating room. He could make tentative dates, but he could get bumped based on higher priority operations, emergencies or something like that. And this happened before on my first 2 operations. So, it was understandable. Okay, so a couple days later, the actual results were posted. And so I had looked at the 3 measurements in the late March and posted them, in comparison to the one in early March. And I was like, well, wait a minute, the volume actually shrank. And I was like, how could this have happened? And I'm like, okay, well, the third number on the late March is significantly less. And I was like, well, wait a minute, something doesn't look right. So I went through the measurements again. The early March one was measured AP by transverse by CC. And then I looked at the late March one, and I was like, oh, wow. The late March one was measured AP by CC by transverse. So the second and third numbers, the measurements were swapped. And since he was only giving me the first 2 numbers, yeah, that would have showed a significant increase. When in the end, it had shrunk 8%, I believe. I'm going off memory here. It was about 8 to 10%. But I had already predicted, based on the 3-week time frame compared to the 12-month time that I shrunk the tumor, it should have shrunk about 10 to 11%. So I was really kind of on course. So I made a decision to go through surgery on the fact that the tumor actually shrunk. I was a little shocked by this, but I talked to my family some more about this and showed the calculations. And I guess instead of trying to fight this for another 9 months or a year based on the size of the tumor, we still decided to go because it would get me back to a 0 point, because the neurosurgeon was pretty confident he could get at least 70, 80, 90%. And the rest could be handled with radiation. And that sounded fair. That sounded fair. So, but I want to say a couple things, because this, even though we decided to, go forth with the surgery, this proved to me 3 things, maybe 4. The protocol still works because it shrunk the tumor by about the same rate as the first time. The second of all, it shows me that I don't think the tumor had adapted from its dormant state into something more aggressive, because it shrunk at the same rate as I predicted if it was the same type of tumor. This also shows me 3 things. I've professed about blocking all of the survival systems and subsystems. And I stress subsystems now because the cancer cell dormancy was a subsystem I didn't know about and was only brought to my attention with my neuro-oncologist told me that the tumor board believed, and this was seen before by the neuro-oncologist, of when cancer cells wake up. You don't kill them all, they can go to sleep. And they wake up at some time, either on their own or they're signaled to wake up, as I discussed in the previous video on that subject. So you have to block everything. If you don't have, if the genes haven't upregulated or changed pathways in some of the systems, you may be able to get away with a partial protocol. But if you want to cover all the bases in the disease, I think it proves that you have to block everything. So in mid-April, I went through the surgery. The neurosurgeon said he got all of the tumor that he could see, so 100%. However, there was still some stuff left behind. And of course, after surgery, I did my post-surgical MRI. And there was something still there. I think it was 5 millimeters by 1 centimeter. And everybody on the tumor, the neurosurgeon and the medical doctor that reviewed the MRI believed that it was a vein, from the uptake of the tumor. And the tumor board agreed with this assessment. So there was still something left behind, but it was not tumor. It was, blood vessels, or a blood vessel left behind, which after all of the drugs had worn off and prescriptions expired from after surgery, the pain pills, the dexamethasone for inflammation, Colace, and anybody that's going through surgical resection knows how important colace is to keeping things moving. Um, so, yeah. So, and yeah, the tumor board agreed with this. So after all of that, I got back on my protocol, full protocol. I'm recovering well. Fatigue is still an issue. I'm still dealing with swelling, and it's been 5-6 weeks now since surgery. My hair tumor is back here. My hair's all come back, pretty normal size. So, and another way that I track my progress, the first two surgeries, I was tracking swelling, cognitive process, by doing Sudoku puzzle that I had on my phone. And the easy puzzle after the first two surgeries, I was about 19-20 minutes. The same thing happened after this surgery. In the hospital bed, I was doing the same thing, the Sudoku puzzles, and I was averaging about 18-19 minutes. And fortunately, at this point, I'm in the 6 to 7 minute time frame. And after I'd healed after the first two surgeries, I was down in the 4 to 5 minute time frame. And now I'm in the 6 to 7 minutes average, and I have had a couple 5-minute puzzle solvements. So that's good. So, but I feel still I have a bit a way to go. You know, the swelling is still the problem. But, you know, I'm going for walks 4 to 5 days a week now. Feel good on it. You know, I have no wobbliness, and I'm eating normally. So diets come back. So that's great. Just still a ways to go. I have my next MRI at the end of June because they want to, you know, stay on top of this. So, you know, right now they're about a month apart. So we'll see this one, how I'm doing. Hopefully everything's gone. Vasculature has gone down. Otherwise, you know, we'll discuss the next steps from there. And during this time, I've celebrated my 3 years since diagnosis. So, you know, that's great. And I plan to keep on fighting this. And at this point, you know, I'm droning on, but I wanted to personally say thank you for all your support, well wishes, prayers, and great thoughts. It's been appreciated by myself and my family. And yeah, I'm doing well, and I'll keep you updated on my condition, especially after this MRI, to let you know how I'm doing. So that's why I have in this video. If you have any questions or comments, please post them below. If you want to keep updated when I do future videos, because I do have some topics in the queue that I want to talk about, and I'll get them out, you know, once I'm feeling better, and do some more research on those topics so I get it right. And yeah, so until that time, we'll see you in the next video. Please like, subscribe, so you can tell YouTube you like the information in my channel and you like what I share of you, bing, free of charge. So thanks again, and we'll see you in the next video. Bye-bye.
Thank you for watching Glioblastoma Strategies and Tactics.